first conversation with our 4 commissioners. So good morning and welcome everyone, and let's get started. And Sharon, I believe you're on mute.
Wow, after all of that, you missed my fantastic opening. Good morning, everyone. I am so glad you could join us today, and we are so thankful that you could take the time to share in this historic and important conversation about collaboration with us. We also want to thank you all who took the time to answer our survey. Your responses have been provided to the commissioners, and they will be responding to what you said today in order to engage with us. Anytime you have questions, we want you to just use the chat feature. Right now, let's test out the chat. I would ask that everyone just let us know where you are and who you are. So just put in the name of the town that you're at right now. Throw it in the chat so that we can get a feel for who our audience is. I see White Plains, Buffalo, Red Hook. Awesome. Thank you all. So today's convening is broken into 2 parts. During the first hour, you will hear from the commissioners of 4 state agencies who have children and youth at the core of their missions. In the second hour, you will have the opportunity to share your thoughts through a facilitated breakout session with your county counterparts. You will automatically be moved to the breakout rooms at the end of the first hour with the commissioners. At the end of the breakouts, we will bring you back for a few minutes to share some feedback from your county discussions, and then ask your opinion of the event in a final exit poll. So please, please stay with us to the end so that we can hear your thoughts. So let's get started. It is my pleasure and honor to introduce our commissioners. Commissioner Sheila Poole from the New York State Office of Children and Family Services. Commissioner Poole, just give a wave so that everyone can see you. Commissioner Betty Rosa from the New York State Education Department. Commissioner Rossana Rosado from the New York State Division of Criminal Justice Services. And finally, Commissioner Sullivan from the New York State Office of Mental Health. Let's give all of our commissioners a hearty hand clap or throw something in the chat to make them feel welcome. Let's thank them for giving up their time this morning to be with us. So to get us started and gain an understanding around why and how we arrived here today, I want to start with a question for Commissioner Poole and Commissioner Rosa. The question is, why did the 4 commissioners believe it was important to have this convening and collaborate at the state level? And why is collaboration needed now more than ever? Commissioner Poole?
Thank you. Good morning, Sharon. I can tell you are on fire today, ready to be an amazing facilitator. Thank you, and good morning to everyone. I see so many familiar names and faces on today's call, and I think before I answer Sharon's question directly, I did want to take a moment just to acknowledge and to provide a special thanks to all of you for taking the time to join us today during what we can only imagine was for most of you, particularly those in schools and social services and probation and other community partners, must be an extraordinarily challenging week given the upsurge in the pandemic, and the fact that you have stepped away from those pressures to join this conversation today, I think is illustrative of the fact that we are together committed to finding ways to work in collaboration, because it is the only way, it is the only path forward for us to collaboratively address and make efforts to address the many, many critical issues that we saw lifted up in the very thoughtful survey responses. So I'll just say, in addition, I talk all the time to the commissioners who are represented on this call. Our agencies, this may not seem so to you at the local level, but in fact, we spend a lot of time speaking together about these issues. But frankly, historically, we always haven't acted together in the ways that we've begun to learn to do more effectively as a result of the pandemic. And that's really what brought us together in a first convening last fall. And the primary driver of that was after schools went off pause. Actually, when they were on pause, right? We saw at OCFS, not unexpectedly, but a precipitous drop in the number of calls to the state central register as children were no longer going to school and were at home. And in anticipation of what schools and families would experience when we went off pause, we were trying to problem solve together as state agencies about the emerging mental health issues that we were seeing in both children and in both families who were reported to the SCR. We were trying to get ahead of figuring out strategies, and Commissioner Sullivan certainly will speak to a number of strategies that the Office of Mental Health has spearheaded to try and address mental health issues. But the one thing we all knew at the height of the pandemic, and it feels like we're still very much there today, is that no one system alone has ever, honestly, and frankly, even more so now, it's been so punctuated, has the individual capacity and resources to resolve the issues that so many of our children and families are facing across our state today. And as challenging as we all know, right, the collaboration is, it just is. Our systems come with our own philosophies, our own missions, our own funding streams, our own regulations, our own constraints. It is hard as heck to collaborate on a good day. But on the other hand, we have no other choice. We must, because there is real power in solidarity and in joining together our resources, right? The best thinking that we have in marshaling our tools together to try and help you at the schools, in communities, in not-for-profits who are on the front and center of working with families. And I can confidently say to all of you on this call that the commissioners come to you today in solidarity, that we are resolute in our commitment to doing our very, very best within our resources, within the strength and capacity and talent of our own agencies to do whatever we can to help you in schools, in communities, and really about engaging our families who are struggling so mightily, but because we know they have tremendous capacity, and how can we work together toward that. So that's what brings us together, Sharon, and I hope that you will hear today the not just talk, right, but the practical ways, the real ways that each state agency, including mine, are really putting action behind the good intention, because action is what is needed. And hopefully it is our hope that today you will find the dialogue, the conversation, the getting to know each of us a little bit better, and that will allow you to feel confident in moving forward with us and continuing these conversations.
Thank you, Commissioner. Commissioner Rosa, good morning. You're on mute, Commissioner. We tend to do a lot of things the same. We were both started on mute.
Thank you. I was just absolutely enjoying listening to my colleague and knowing how the last several, I would say almost a year and a half, has given us an opportunity to really truly look at our work together and realize that the sum of the parts are much more powerful when we really give voice and we share each other's work, and realizing that the organism really has different components, but it has to function when those parts come together in a healthy kind of way. And so one of the things that I have really truly not only enjoyed, but have come to realize that a lot of times we really become consumed in our own individual work and do not realize the importance of those intersections, the importance of the fact that the work that we think about when we think about in education, our students, is grounded in families, is grounded in communities, is grounded in the work that all of us collectively do to support each of those units. And so this has been an incredible, powerful way to think together, to have thought partners, but more importantly, to think about what are the ways that we can find comprehensive solutions. A lot of times we look at situations and we try to look at complex issues, and we realize that simple solutions don't get at the issue of addressing the complexity of our communities, the complexity of our families, and those issues that impact on their daily lives. The fact that we have had an opportunity to share each other's lens in a kaleidoscope kind of way has been very powerful and enriching to all of us. We've been able to really share our thoughts about health issues, our thoughts about families, children, our thoughts about the crisis that we have, even with our youth, and how do we create opportunities to be preventive, and how do we operate in a system that is responsive, caring, and a system that truly looks at all these issues in a way that allows us to find comprehensive solutions. And so our work together has really connected all of us and has given us the opportunity to really look at the way that we find solutions is by staying connected, number one, sharing our best thinking, and knowing that at the end of the day, it is truly about lifting all of our communities, lifting all of our spaces and places. And so I am absolutely grateful. And I do have to give a shout out to one of our newest Commissioner Mary Bassett, who has been in a short period of time. She's not with us today. She wanted to be with us today. Has been amazing. When I tell you, totally amazing, and has really given us the opportunity in our department to once again connect and think together to find ways that we can support our landscapes. So I am so grateful to all of my colleagues. I'm particularly grateful for what they do every single day to make a difference.
Thank you. Thank you, Commissioner Rosa. And thank you, Commissioner Poole. Two nuggets that came out of that. No one system alone has the capacity to resolve the issues our family and children face. So therefore, we have to stay connected and share our best thinking to lift our communities. Based on what we just heard, Commissioner Sullivan, can you please share your thoughts on the current mental health needs, services, and supports?
Thank you so much. And I just want to say that it's a real pleasure to be here today with all of you. And just as Commissioner Poole and Commissioner Rosa have said, we've been working together. And I think that that kind of teamwork is really what is needed more and more as we go forward. If anything that this pandemic has taught us all is that working together and teamwork is so critical. First, I'd like to thank all of you out there in the audience for what you've been doing for the past 2 years throughout this pandemic. It's just been remarkable. and the cooperation that all of you and the coordination, we're going to do better. That's what today is about. But what we've all been doing is just so impressive. And I think one of the things that's been highlighted over these two so stressful years has been the mental health needs of our communities. And I think there was a famous Surgeon General who said there is no health without mental health. And I think that that's so true. And I think that this pandemic has made it clear for all of us. So the mental health needs are big, and the mental health needs will continue to be there. You know, a lot of the studies post-disasters or pandemics often show that basically mental health needs continue long past the initial crisis. And certainly with our youth who have been so affected by this pandemic, we can expect that to be the case. So we have to be ready, and we have to kind of build the kinds of resources that are not just post a crisis, but go on probably for years in terms of the ability to work with our families and our communities to make sure that mental health is as strong as it needs to be. And we're going to be going through the results of the survey, and mental health came out with a big issue here. And I'll be talking later about the resources that we're putting up. And I think if any of you had the chance to hear from the governor yesterday, she spoke very clearly about her investment in mental health in schools and other areas. So I'll be going into that in more detail, but I do want to let you know that we are all working, all the commissioners, and certainly the Office of Mental Health, to make sure that the mental health of our communities is strong throughout this pandemic. And I'll be going into that in more detail. And then just one other word to everybody who's here on the call. You know, take care of your mental health too. I just want to always say that, because sometimes those of us who work in these positions, we get very involved in helping others and doing things for others, and that's terrific. And our teachers are so concerned about the youth and the kids and the families, and our parents are all concerned about the kids, but you have to be concerned about yourself too. So please take care of yourself. And New York Project Hope is one easy way to do that. It's a NewYorkProjectHope.org, and there's lots of opportunities on that website for self-help, but also for counseling or just talking to somebody, or being part of a wellness group, or being part of a group that's just talking about the stresses of everyday living under this pandemic. So please take care of yourself. That's the other message I want to say. And then I'll be talking later on about lots of resources that we hope will be helpful to you. And then we're really looking forward to the second half of today, when we hear from all of you. Where are the gaps? Where are the problems? What aren't we doing right? And we want to all do that together. So again, thank you for all the commissioners for pulling this together. And thank you so much for all being here today. Thank you.
Thank you so much, Commissioner Sullivan. And thank you so much for encouraging us to make sure that we take care of ourselves, because self-care is very important. And you spoke about the survey. So speaking of the survey, right now, I would like to give a brief overview of the responses received from the survey. And again, we want to thank you all so much for responding. Next slide, please, if the slides are up. Our first question asked you to prioritize the most critical issues in your community. Not surprising, concern for our children was the #1 concern, followed by affordable quality mental health services, student and adult well-being, and re-engaging disconnected students. But as you can see, all of these issues are pressing concerns within our communities. Next slide. We then asked a series of open-ended questions. Some of the most salient points are represented in the next few slides. The first questions we asked were, what were the most critical barriers to addressing the concerns raised in the first slide? Probably the most cited response was mental health issues related to the pandemic. Challenges such as access to clinicians, early identification, lack of mental health services in schools, social emotional well-being issues related to the isolation and anxiety of the pandemic. We heard that a lot from our students, right? And families. The racial pressures in our society, community and gang violence, and the reliance on social media and the heightened potential for the spread of misinformation. I don't think we really know the impact that social media has on our society today. I think in the coming years, we will really see. Other barriers included engaging families and students in their education and connecting them to community supports, learning loss due to the pandemic and remote instruction, the need for flexibility and funding on both the state and the federal level, and staffing challenges. In just 1 year, the entire workforce shifted, and we are truly doing more with less. Next slide, please. We then asked what you needed most from your community partners to address your community's most important concerns. Number one, and why we are here today, you told us you needed partnerships, more communication, collaboration, improved working relationships, network meetings, systemic approaches, better communications, better connections, increased cooperation, and shared planning. Not surprising, the ability to use blended braided funding was another theme. Embedding mental health in schools with other critical services, and schools should act as the hub for the community. That was a very important one. Next slide, please. Based on those responses, we then asked what you needed from the state agencies to address your community concerns. The top two responses were increased funding to open more mental health supports in communities and schools, including more flexibility in the use of funding, and reducing regulations to allow systems to function without barriers. I think we heard two of our commissioners mention those two in their opening remarks. And a few more important themes that emerged were after school and summer program funding, increased professional development and training, we know that that's important, and decreasing pressures related to COVID testing, tracing, and the opening and closing of schools. That has just become a daily part of our lives today. Next slide, please. Finally, we asked you how your organization could help address your community's most critical issues. As you can see from this slide, and I encourage everyone to just take a moment and really take a good look at this slide, several themes emerged. Some of the themes included providing safe places for healthy activities and bringing partners into these safe spaces. Summer programming and extended day programming, again, that's there. Mental health clinics in our schools. Continue to implement social emotional learning. Offer the school space, again, the school space, making it the hub of offering activities, both after school to the community and also welcoming other community agencies into the space. And working with families and providers to identify and access resources, increase and encourage partnerships. And if you know how this particular exercise works, the letters, the words that are the largest are the ones that were input the most. So community, families and schools, support, work, needs, district, all of that stands out. We've got a lot of work to do. And that's why today's convening is so important. So at this time, I want to go back to our commissioners to hear their thoughts regarding the issues and concerns that you raised from the survey. I'm going to ask a series of questions. As a matter of fact, I'm going to ask 3 questions. And I'm going to give each commissioner an opportunity to respond. Now, commissioners, you are on the honor system. And I'm asking you to keep your responses between 3 and 5 minutes or less, so that we can make sure that all of our participants get the most of this historic convening of these 4 powerhouse agencies. And I have to just say, I don't know if you noticed, but all 4 of those agencies are run by women. I just had to point that out. I couldn't resist. Whoop, whoop to the women that are in charge. So 3 to 5 minutes or less, you're on the honor system. And reminder to our audience, please add any questions, comments, any of your thoughts in the chat. We are monitoring the chat. The chat is being recorded and the responses, we're going to address everything. Maybe not today, but we will get back to you with anything that's in the chat that we need to follow up with. So my first question that I'm going to put out to the commissioners is, given the gravity of what was raised in the survey results, improving educational outcomes, reconnecting disengaged youth to schools, student and adult well-being, and the need for affordable, accessible mental health services, what stood out for you as the issues of most concern? I'm going to start with Commissioner Rosa for this question. Commissioner?
Thank you. Well, in looking at the words, obviously, to your point that we looked at the word community, we looked at the word support, we looked at social connected systems. And that particular phrase really stands out because we have an obligation to create safe spaces and places for our families, our students, our communities, in order for our students and our communities to really flourish. And one of the things that in this particular situation stood out, obviously, was the issue of how schools are the hub. And so part of that raises the issue of looking at community schools, looking at ways that we can create opportunities to bring our families together in ways that we can address many of the issues, mental health, clinical, all the different issues that all of us are connected to bring them all in a one place, space way to address those issues. We know that, for example, if we're looking at healthy children, we have to look at the whole child, a comprehensive way of looking at the whole child. If we think about healthy families, we have to do the same thing. How do we support the entire family? How do we support the entire child? And community schools and schools as hubs of places where we have to address the many issues and the complexity of these many issues in order to have students succeed, in order to have families connected to the hub. We know that we have to do a great deal of work across each other's space and areas. And so getting past the barriers, the speed bumps, getting past the issues that really get in the way. And sometimes those issues are financial in terms of resources and the way we isolate these issues. And sometimes these issues are, the barriers are created by the fact that we don't have the opportunity to engage and come together and at the local level. So part of what I think we're trying to do is model some of this work that we know needs to happen at the local level. And in modeling and demonstrating our own actions by sharing resources, by looking at how do we improve educational outcomes. But we have to look at those not in terms of just the educational system. We have to look across the various systems. We have to figure out how do we create preventive ways that address youth from the early childhood perspective all the way through so that the issues that we need to address get addressed early on. How do we also work with families where there's trust, where there's a sense that they can be very much a part of the solution, where they're given opportunities for their voices to be heard, so that we don't think about what they need, but we really ask them and get their perspective in terms of what they need and not just what we think they need. I think the survey really highlighted not only just the mental health aspect, because we know that in order for children to be successful, we have to look at all the various issues, all the various challenges that really impede and get in the way. And I think that part of what I've learned from not only the survey, but from our own communication is that the guidance we provide has to be grounded on the work that's needed at the local level. And by local level, I mean at the school level, at the family level, at the community level. So I would submit that we really truly have to look at student success, family success, community success together. And it cannot be done in isolation. And so I know that today's convening is the beginning of realizing that our work, our intersections are so vital to the intersections that need to be transparent and need to be exist in all of our communities. And so I think that many of our actions, which we will share with you, some of the things that we're doing that are very concrete and are very what I would call action oriented, are the kinds of things that I think that are critical to the success of our students being able to demonstrate their improvement both in the academic, social, emotional, civic, and really truly being the kinds of individuals that give back to their communities.
Thank you, Commissioner. Commissioner Rosada, what are your thoughts?
Good morning. Thank you for
Good
including
morning.
me. I'm really happy to be here. This is my 5th week with DCJS, and I am not surprised that Sheila, Commissioner Poole, and Commissioner Rosa, pulled this together. And I want to tell you that I have been in government for 6 years. I was previously at DOS, at Department of State, as Secretary of State. And these are not forced collaborations, right? This is something they took upon themselves. And I believe, this sets the example for how government should work, that we come together because of the basic need to serve and the commitment to those who we serve. So although I'm new, I want to let you know what DCJS has been doing even before I got here. And I just want you, all of you out in the community and the districts, to know that the power of 2, 3, 4 commissioners coming together, the impact is amazing, right? It's amazing to see. So I congratulate them. I'm not surprised knowing the 2 of them and the work they do, and obviously also Commissioner Sullivan. So I'm just happy to be here, and it's a very, very nice coincidence that we all happen to be women. But it also isn't surprising that when women come together, we put family and children kind of at the core. So my Division of Criminal Justice Services is committed to collaborating with our partner state agencies, community-based organizations, and all the key stakeholders to improve outcomes for youth and families throughout the state. The voices and needs of young people have to be at the forefront of our work to ensure that they remain meaningfully engaged and in education and positive social development, and eventually employment. This survey highlights the complex challenges to our collective efforts, both within the classroom and in our communities. And from the DCJS perspective, we want to continue to serve youth who become involved in the justice system and provide resources and services to enhance their success. But also, we must find ways to prevent system involvement in the first place, which is why a partnership with SCD is so important. We have a lot of messages to bring to be preventive, and our mission is to deal with the problems when they happen, right? And our practice is that. But our commitment is to be involved on the front end in preventive efforts. And I think that's a place where we could hear your ideas about how we could do that, and where we welcome innovation, because we have what we say in Spanish, we have the ganas, right? We have the will. And what we need is the different ways to do that. From our interagency work to implement Raise the Age to our internal juvenile justice programs, we want to find ways to better support young people and their families, not just when they're in trouble, right, but before they get in trouble. As we look for points of intervention and alignment, DCJS, or the staff, and I'm joined here today by Damon Bacote, who's on. He heads our youth justice, part of the agency. And also I saw Bob Macaron is with us, who is on the probation side. So everyone at DCJS is mindful of our impact on youth justice, kind of writ large. So specifically, I wanted to mention DCJS's Office of Probation and Correctional Alternatives, we call it OPCA, which regulates and provides technical assistance and training to 57 county probation departments in plus New York City. DCJS data provided on our public website indicates that in 2020, there were 10,465 intake cases involving youth between the ages of 7 and 17 who were referred to a probation department. And statewide, 40% of those cases were resolved without court intervention following a probation conference or a period of adjustment services. OPCA recently established a juvenile operations unit solely focused on providing additional technical assistance and training to ensure more youth are successfully adjusted and diverted from further probation and court involvement. And again, we cannot do this without your partnership and without, in some ways, involvement with the schools. Also, DCJA SNUG, we have a lot of acronyms in this agency. SNUG is an evidence-based violence reduction initiative that was first established in 2009. And that program seeks to engage high-risk individuals who are causing violence in communities with high rates of violent crime. We address the issues that may be causing the high-risk individuals to engage in gun violence, and we share that information with the community. You may have seen in the state of the state, the governor mentioned the gun program and has committed to further fund it. The SNUG program is working directly with youth who are disconnected from school and work, and is in the process of developing a strategy to better advocate for them as well. We're in the neighborhoods, we're in the streets. DCJS recognizes that building trust with the community is fundamental to effective policing. So in 2021, we began a new initiative that facilitated conversations with police and community members, including the SNUG outreach workers. And also in 2021, DCJS was awarded an Office of Juvenile Justice and Delinquency Prevention, OJJDP, grant in the amount of $1.5 million that DCJS will use to develop and implement a strategy to improve youth and police relations. We think this is fundamental and important. So finally, DCJS is designated as the sole state agency to supervise the preparation, the administration, and implementation of the state's juvenile justice plan, and to ensure compliance with the federal core requirements of the Juvenile Justice and Delinquency Prevention Act, one of which is reducing racial and ethnic disparities in the juvenile justice system. So DCJS's Office of Youth Justice focuses on reducing racial and ethnic disparities among youth that come into contact with the criminal justice system by providing technical assistance and training to the various stakeholders. In addition, the DCJ Office of Justice Performance and Research posts data on our public-facing website by race, ethnicity, sex, so that localities and stakeholders will have a better understanding of where to focus their efforts. So I'll stop there because we have so much more to share, but I'm going to respect the time, and I'll come back to you. Thank you.
Thank you, Commissioner. Commissioner Poole, I'll turn to you. What are your thoughts about the survey?
Wow. Commissioner Rosado, congratulations. You've only been there 5 weeks, but you are spot on. And some of what I'll talk about at OCFS is a reflection. It's a mirror of some of the strategies and sort of upstream prevention that you spoke of. So, what I want to say first about this part of the conversation is what lifted up right out of the word diagram: family, community, support, school. And when it comes to my own agency and OCFS, we've been having a lot of very provocative conversations within the corners of our agency about not accepting sort of the self-talk that, well, we can't do this because our funding streams don't allow us, or we can't do that because our regulations say this. I mean, the fact is, if we want to solve for a number of the issues and challenges that you all lifted up, and honestly, you all know that for the most part, what was lifted up in the survey, they are not new, right? They are not new issues. They are simply lifted up in a highly intensive way because of the pain that families and communities are feeling as a result of the pandemic. But we're really challenging ourselves. I am challenging my team. I'm looking at our deputy commissioners, Nina Aladort, who many of you know, and of course, Lisa Garti Ogundimu, who's doing some amazing work in our Division of Child Welfare, but challenging us at OCFS as we are in this partnership work to be one less bureaucratic. And that's not easy for state government to do. But really, when we are producing guidance and documents and directives, speaking in a voice that really reflects or asking ourselves, does this speak to our mission as an agency? Or is it, a bunch of legalese, right, sort of regulatory language that is not really sending the right message, is not really supporting the right kind of work at the local level. We are using both our parent as well as our youth advisory board to sort of check us, good government bureaucrats, to give us feedback about plain language. Does this resonate with you? Are we doing harm in our equity work? Are we speaking to the communities that we're trying to serve? So I want you all to know, we are really challenging ourselves here in our work across the board about really trying to be less bureaucratic and really more responsive to getting the work done in the way that we know it has to be done. So another area that we are really, really intently focused on, and this sort of gets to the finding new ways to use our money to serve the public good in the ways that we really want to serve children and families, but are no longer accepting the constraints that some of those funding streams have brought to us. In child welfare, as you all know, all too often, children and families get help only after they've been called to the attention of the system via a report being made to our state child registry. And we know the overwhelming majority of those reports that come to the system are either unfounded, or we know that really when you get at what brought the family to the attention of the system or for a mandated reporter to call, is that a family really needs things. And oftentimes it's things that are driven by poverty, lack of housing, lack of other supports, lack of access to really tangible, simple things that we all, I would submit, take for granted on this call. And so what we've really been trying to do is to really look way upstream, and to Commissioner Rosado's point, to do whatever we can to give families who have great distrust of many of our systems, and our child welfare system, is at the top of that. We hear that from families all the time, that they will do anything to avoid coming into contact. And unfortunately, sometimes that means that they really are fearful of asking for the help that they need. And we've got to address that and understand that head on. So a couple of things that we are doing very intentionally here at OCFS is we are expanding our support of a system called Care Portal. And I know some of you in the counties where Care Portal exists are aware of this, but it's a very beautiful, simple concept. And it's that there's an online, low demand, light touch way of a caregiver or a caseworker being able to log on and to say, I am aware of Sheila Poole's family, their washing machine broke. You know, they're on public assistance. They don't have the money. This is why their 2 children are coming to school with dirty clothes, right? And anyone, and I know we have lots of social service commissioners, you know, on here today. These are seemingly the most simple, light touch supports to give to a family. Yet I can tell you in our current system, they are the most difficult to actually get to families in the most expedited way. It is far easier for a local district to open up a case in WMS for mandated preventive services after a family has gotten pretty upstream in our child welfare system to really get the kind of help that they need. And how wrong is that for our families? So we're expanding those care portals. Our faith-based communities are very much the underpinnings of that, but we want to put some of our resources at OCFS behind that capacity so that those families can really get access to goods and services that they need, that they are driving before the system has to drive them to those supports. We have a lot of family resource centers that we've been supporting through our child welfare dollars. You know, that's the magic, right? When families feel like there's a safe place to go with a trusted not-for-profit provider in their community that's not the face of government, that they feel safe walking through that door, that they can get a myriad of supports again at their own request. So again, expanding upon those concepts in a little bit, Commissioner Rosa will talk about an exciting opportunity that will be coming to our state in 2022. Something else we're very, very excited about, I'm sure you're all aware of the universal basic income pilots that have been spreading across the country in recognition of the fact that so many families who are on public assistance, who are receiving SNAP benefits, HEAP benefits, right? All of our public service benefits could really be strengthened by having just simply more cash. And this is a model that's been piloted in California. And it's a research-based evaluation that it shows by giving a family an extra $500 or $1,000 a month over a limited period of time has pretty amazing, powerful outcomes in decreasing their contact with the child welfare system. So we've been watching these pilots across the state. Lisa, our Deputy Commissioner in Child Welfare, has been working with our partners at another state agency, the Office of Temporary and Disability Assistance. We have a research partner. We're working with the University of Pennsylvania, and we will, in 2022, be launching a universal basic pilot initiative for a group of families involved in our child welfare system. So again, really trying new models and challenging ourselves at OCFS at looking at our existing, because right, we can't always wait for the magic new money, because guess what? It often doesn't materialize. But looking at our existing funding streams and wherever possible, challenging us to repurpose those or think of those more creatively and in a way that really supports these goals of family, community, and light touch supports. And finally, I think the other thing that is so exciting about this collaboration among our state agencies is this idea and honestly this reality of of blending, right? Braiding. We've talked. How many of us have heard about blending and braiding funding streams for 30 years? Raise your hands. And it's darn near sort of impossible to achieve the ideal. But we can, in fact, get way upstream by combining our funding streams, right? Not changing them or transforming them, but by pooling them together from our respective state agencies and using them to create something that is more cohesive, right? We all send out our individual funding streams, right? Our local assistance grants, our RFPs, right? And everyone's scrambling at the local level to try and respond to. I think one of the things we're really trying to do is, when there is one of these challenges, is to say OCFS, OMH, DCJS, SED, OTDA, there's others, they're not on the call, but saying, what can you bring to the table to do a piece of this new sort of collaborative service? And I think that there is tremendous opportunity, because that's really where the magic is. And I think that that's what I'm really so grateful to my sister state agency leaders, that there is a willingness to come to the table in that way, in pooling our resources more collectively, because we know you all need sort of a more cohesive, holistic way of serving our children and families in community. So I'm sure I've gone way over my time. I'm so sorry, Sharon, and I'm going to put myself on mute.
We're going to put you in the corner. Commissioner Sullivan, more services, resources, staff, communication, and awareness of services really stood out as areas of need across all 4 state agencies. Give us one way your agency can respond to what the field sees as needed to best serve the needs of children and families. Thank you.
Thank you. I'm going to give you more than one way because it's a little complex to figure out the key thing. I think there's 2 key things here. First of all, mental health services have to be interwoven into everything that the other commissioners have been talking about. And I think that's our goal, is coming together, that we don't do these things in isolation, but we do them together. Secondly, I think there's 2 buckets here with this pandemic. The first is prevention, which everyone has been focusing on, which is not a minor thing at all. It's very critical. And then there's actual mental health services for individuals that find themselves in need because of depression, anxiety, or trauma. So the first one, in terms of prevention, I have to keep emphasizing the experience that we've had with Project Hope across New York State. We have contacted 300,000 New Yorkers who have contacted us either through phone calls or through group sessions to deal with the stress of the pandemic. That's a huge preventive outreach effort. And that's something that we would like to continue going on even past. The Project Hope is funded by a huge FEMA grant, and we would very much like to continue that even after the FEMA grant is gone, to continue that kind of preventive work. The vast majority of people reached by Project Hope never had a mental health issue before. And I think that speaks to the impact of this pandemic and the importance of prevention if we're not going to have some of the long-lasting mental health issues that we're also concerned about. We know that up to 50 to 60% of Americans are going to have an impact from this mental health impact. We know that double the number of youth have depression and anxiety. We know that triple the number of youth have been coming into emergency rooms with mental health issues. So all the data is there to show that this pandemic's having its impact. The question is, what do we do? And the first part is that kind of preventive work, where you work with individuals who may not yet be showing serious mental health problems, but you want to help them not have that happen. So the work of something like Project Hope is critical in that, a combination of crisis counseling, group counseling, wellness sessions, the ability to do self-help online, all kinds of things, which is all part of New York Project Hope and something that we want to continue. The second big bucket that I know everyone is very concerned about, but what happens when somebody needs mental health services? Well, you know, right now we're doing a massive expansion of mental health services, but we're all feeling the crunch right now. Partly 2 things. One, workforce issues. And I think, again, the governor addressed this in her speech yesterday in trying to keep the mental health workforce. And secondly, setting up some systems or expanding some systems that maybe we need more of to increase access. One I'd like to particularly emphasize is school-based clinics. School-based clinics, a school-based clinic is a satellite of a mental health provider in the community. So it does 2 things. It provides school-based services, but it connects that school-based clinic to the range of mental health services and other services in the community, because there's a parent organization that works with the school. So when we all talk about partnerships and collaboration and getting out into the community, school-based mental health clinics, I personally think, are one of the biggest ways we can help the schools. We have about 1,000 school-based mental health clinics across the state. That's still not, we have about 6,000, so it's not there yet, but we will continue to grow. We want to grow. And for anyone out there who wants any more help with this or work with this, contact us, because we have some dollars to do startup to get these things going. We want to expand this dramatically over the next year or two, so that basically we have that on-site service, which I think so many, when I looked at that survey, so many people wanted. The second issue is the kind of work that we can do in schools, separate from clinical services, is trainings, learning sessions, mental health first aid, suicide prevention, doing work on trauma, doing an assessment of schools, something we call a SHAPE assessment, where schools work with us to see what they need. All these things are available, and they're going to be available on a resource sheet that we're going to send out to you. You just have to contact us, and we'll be glad to work with any school interested in any of these services. We have been doing them for years, but we're expanding them dramatically. We taught, I think it was 13,000 school personnel last year on suicide prevention across the state. So we're out there doing this work. We're here to do it with you. We have a trauma-informed network. We have a number of things. Now, so that's the second big bucket. The third big bucket, which I think impacts a lot of OCFS and juvenile justice, is for the more seriously affected youth and families. And here we are doing some significant expansion of child act teams. We're going to have 20 child act teams across the state. That's assertive community treatment teams. They're community-based intensive work with families and kids. That'll serve about 1,000 New Yorkers over the next year as we begin to ramp up the ACT teams. And we're also in the process of adding more home-based crisis intervention work. The focus here on community-based intervention for those high-need families that we can do without kind of institutional work, but doing really community-based work. And those services are also being ramped up. And then just to mention that telehealth has been a huge boom to mental health services. And those, thanks to a lot of advocacy, thanks to our governor, thanks to our legislature, basically telehealth services, especially for behavioral health, both substance use and mental health, will continue to be paid for pretty much and covered by Medicaid as they have been through the pandemic. And there's a lot of push to make sure that happens in Medicare and also in the private sector. So telehealth is here to stay. And telehealth has been very, very helpful in enabling us to expand access to mental health services. It's not everything, but it's very, very helpful. And that's something that we're going to be doing. And we also use telehealth sometimes even in our schools, where it can be helpful to have, if you have a social worker in the school, but you want to talk to a psychiatrist, that psychiatrist can kind of beam in on telehealth and get that work done right there on site in the school, versus having to go to a clinic or leave or not have to have multiple appointments. You can do it in the school. So again, focusing on those school-based services is something we really want to do. We want to expand them. Telehealth has significantly helped us with that. And then one just last hint that I want to say is that sometimes individuals with mental health insurance, not Medicaid, but more private insurance, have trouble accessing services through their insurers. If you do, there's something that the state has put up called CHAMP, C-H-A-M-P. You can find it on the website. You can call them and they will work with your insurance company, and they even have lawyers who will work with your insurance company to make sure that you can get the services you need. So if you're beginning to feel like you're getting a bit of a runaround from your insurer, maybe they just don't understand what you need and you don't understand what's available, or maybe there's some difficulties, use CHAMP. Just call them and find out. And that's there especially for individuals, I think, who have more commercial insurance, because sometimes that can be difficult. Your commercial insurer is responsible for getting you the services you need. They can't just tell you there's a waiting list and sorry. So I'm just giving you that hint for services as well. But we will also be expanding our clinic services and a number of other initiatives, and we'll go into them all, that will help expand the workforce and will help increase rates, because increasing rates increases salaries, increases workforce. So there's a number of things that we will be doing over the year. We are hopeful putting it all together. We will have a significant increase in access, but I would strongly recommend for those of you in the schools to please work with us on school-based services, because we would love to have more of those. We would love to expand them. And I do believe it begins that critical connection, school to community. You know, often there are services in the community. It's how do you get to them? And I think that we need to be better at that. It shouldn't be hard for a school to get to them. But that connection of the school-based clinic and then into the community is just a little bit golden in terms of making sure that those connections happen. So I'll kind of stop there and see if there's any other questions. Thank you.
Thank you. Thank you, Commissioner Sullivan. Thank you to all of our commissioners. Let's give them all a little virtual hand clap or throw something up in the chat. Unfortunately, we have reached, we've reached the end of the first hour, and we've got to get you all into the second part of this convening. So I'm just going to put it out there to the four commissioners. There's more to say, there's more to share. I think we should plan a second convening. I'm just going to put it out there.
Sure.
Yes, can I get a nod?
Yeah,
from
sure.
the four
That would be
commissioners?
fine.
Yes.
And I think it would be very
Yeah.
helpful after we get the feedback from these sessions, also
Absolutely.
for us to be able to answer that feedback.
Yeah, so we're gonna plan a part 2 so that we can hear more from our commissioners. But right now, I want to get you all ready and prepared for
Sharon,
the second important hour. Yes?
Sharon, it's Lisa. Before we go into the second hour, there's just one other topic that we really think is important to share with the group today. If we could just touch briefly on the third question about the collaboration that we wanted to share with the group before going into the next.
I was just trying to keep it to the time, but if
I
you're
know you're an amazing moderator. We'll
full
later.
speed ahead. So the final
Thank you.
question that I have is, what collaboration is currently happening and is planned at the state level? And I'm going to start with Commissioner Rosado for this question.
Well, I'm going to save you the time because I have no idea since I just got here. And I think Commissioner Poole and Commissioner Rosa have the best information on that. I will say this, that as you do the breakout rooms, I'm really interested to hear from the stakeholders in the following. I believe that as government agencies, we produce for our own purposes. We produce a lot of data. We don't produce it, but we collect a lot of data. We have a lot of information. I would like to know from you, what can we give back to you that would help you, in developing and proposing, what information can we give back to you? Because we don't always do a lot with it, right? We collect it and we kind of move it up. But I think it would be great to figure out what use you have for all the data we collect. So I'll just stick that in there and I'll turn it back to Commissioner Poole.
Okay, great. So just very, very quickly, we commissioners believe that, intention is great, but action is even better. I think us continuing these convenings with you holds us all accountable to action. I also want to challenge all of you at the local level, right? That we'll do our part at the state level, but it's exponentially more powerful when your local social services, school, not-for-profits, probation, mental health work together, right, in similar ways. And I'm not suggesting you don't. Some of you do it remarkably well. And frankly, we've taken some cues from you. But there is tremendous power in sort of that model at the local level. But we've been trying to, as I said, to develop a really intentional action plan. And so OCFS, in collaboration with Commissioner Rosa and her team, and I know Commissioner Sullivan, you're also in there with us. Soon, hopefully in the next month or so, we will be together issuing a request for proposal for a collaborative model called a Family Opportunity Center. I hope I got that right, Lisa.
Yes.
FOCs. And again, it's a very beautiful model in its simplicity, right? The idea is to bring supports that are needed by families, when families need it, in a place where families feel safe going to ask for it, in a place where others around a family are seeing the need for that family as well. So, we're precluded a bit by, again, our bureaucracy and our procurement laws and the comptroller. We can't get too far ahead of ourselves, but we're super excited about this combining of funds from our 3 agencies to be able to make some new magic happen statewide. And so, Commissioner Rosa, I'll turn it over to you for any
Sure.
final remarks.
Sure. Very quickly, as somebody made reference to the sisters, but in this, we're sisters and brothers, and we definitely are looking to be a bit disruptive, but at the same time innovate. And so in this process, we are very much looking at being service oriented and being, to Commissioner Sullivan's point, being agencies that look to respond to the pain points and the needs of various community. So all of us collectively are very excited about the issue of family opportunity centers. And this is only one, and it's only the beginning of many of the things that we want to see happen at the local level. One thing I do want to share is also the issue of sharing information on the various websites. We really want to make sure that we have opportunities to take the information and repeat it and share it across agencies so that parents, school staff, community, the various agencies, the various stakeholders, and other advocate groups begin to see the same information across the board. And I think the Family Opportunity Centers is going to give us an opportunity to really bring all of these resources into one place, particularly when you think about the impact of these resources on families, communities, and students. And so we're pretty excited about the $2 million appropriation that we hope to. And this is, again, this is only the beginning. And we want to really, truly see that our actions are demonstrated at the local level to truly say to our students, our families, all of our educators, all of our social workers, all of our mental health providers, everyone, to say we're in this together. And the only way that we know how to do that is to be very intentional and to create a foundation and be very functional in the way we respond. And our actions have to speak louder than our words by seeing it, touching it, believing it, and regaining the trust that our communities so desire and want us to provide for them. So in the spirit of being service oriented, in the spirit of being collaborators and communicating our hope, our dreams for our children, our families, our communities, we truly want to begin here, but also know that this is only the beginning, and that in fact, all of our communities are going to see not only our interagency work together, but you, the audience, your work together as a way of demonstrating and showing that we, in fact, are so committed to this work. Thank you.
Thank you. Commissioner Sullivan, final words?
Just to say that the Family Opportunity Centers are just a marvelous example, I think, of the kind of together working of all these agencies, and we'll interweave mental health. Mental health will be there. So the families have one place to go to kind of get the services they need. And I think that that's just so exciting. So we're really very excited about being partners in this new initiative.
Okay. Well, thank you, commissioners. And, I agree. It is worth it to announce a $2 million appropriation partnership. So kudos to that. Let's give all of our commissioners another round of applause. Throw something in the chat. Let's show them our appreciation as we get ready to transition into the second part of this historic convening. You will be sent automatically to your county breakouts. And the breakouts will be facilitated by our wonderful BOCES DSs. There will be a state agency staff person in each breakout room taking notes. We look forward to hearing your thoughts and recommendations. And please, please, please don't forget to stay with us till the end for the poll on your thoughts regarding this convening. Thank you so much. Again, my name is Sharon Cates Williams. It has been my pleasure to be the moderator this morning. Have a wonderful rest of the day.
Thank you so much, Sharon. A round of applause for our moderator this morning, doing a great job for a really exciting conversation. Before we go into the breakouts, a couple of quick technical reminders. As we start the breakouts, there is one for each county that is represented here. You will have a number of prompts pop up on your screen, likely up to 2 prompts. Please make sure you select yes, basically confirming that you'd like to go into the breakout room and that you'd like to move your audio to the breakout room. Again, if you have any technical problems as you're moving around, that 1-800-810-1349 technical support number is very critical, super important if you do need that as you move into the breakout space. Once you're in there, you'll be able to unmute, turn on your camera, and as Sharon shared, there will be both a moderator and a facilitator and a note taker in that room waiting for you. We're going to give you just about 25 minutes, and we're going to go ahead and start the breakouts now. So Amanda, if you could go ahead and pull people into their breakouts, we will see you all back in about 25 minutes. Welcome back, everyone. The breakouts have ended, so folks should be coming back to the main room. You'll make sure to select all the prompts to reconnect and move your audio over. But I like to speak through this process just so folks know that they're back in the main room and that their audio is getting reconnected or is connected. And we'll give folks just a few more minutes to pop back over and make sure that their audio is working well. We hope you had a good time in the breakouts, that you had a lot of good open discussion. We're very thankful for the time you took to orient yourself to those. It looks like folks have moved back to the main room, so I'm going to pass it over back to our planning committee, who are going to work to wrap up our event this morning.
Thank you, Greg. We have about 9 minutes left. It's very important for us to at least hear from each of the groups. So I will call on each county, and if you can just county group and just identify one nugget that you'd like to share with everyone, we'd really appreciate it. I think the learning is best when it's shared. So why don't I just go right down the list? We'll start with Suffolk County. Just one thing that you'd like to share with the group.
Hi, it's Mary Ann Braithwaite. I want to make sure I understand the question because that was my group. One nugget, you mean like something that was sort of central to our discussion?
Yes, I'm so sorry. Yes, Mary.
No, that's okay. I just want to make sure. So I think one of the biggest issues we were talking about was workforce issues, at least in terms of mental health services. We have some really great programs, but we are really finding that more recently workforce issues have been really impeding our ability to do the great work that we can do.
Mental health services.
Yeah, but again, more specifically for the work, it's lack of staff, really.
Lack of staff
within the programs. Yeah.
Thank you.
You're welcome.
Nassau County.
Hi, everybody. Can everybody hear me okay?
Yes.
I think one of the things that came through was partnership and interagency meetings, to bring people together. It sounds like Nassau is already doing that, to some extent, talking about the struggles and barriers in each system, where people were really grateful for, I think this conversation today. I think what they were also saying is that they'd like to kind of be able to work at a more local level. Also the importance of, I think, blending funding streams. And this is something that's come up a couple of times now. What if every agency was willing to kick in, kind of some money to make an initiative happen, to create supports, kind of that would be able to be shared. And, so again, more collaboration between the three offices, let's say OMH, OCFS, Juvenile Justice, kind of how can we all be better working together and to create the capacity that we needed. And then also just that there are definitely some things that are currently services that are present in Nassau County, but, depending on who the families are that are trying to access them and where they're located geographically, they may not necessarily have a car or the transportation to be able to get to, kind of those services and to access them the way they would like. So those are there's a lot of other things that I have down here, but those for me would be the highlights. Okay.
Thank you so much. And please note, I know there are lots of notes were taken during the session. We are going to call that information and share it with everyone, but we just wanted to lift up some key points right now. Monroe, Damon.
Thank you, Lisa, as I've been tagged. But I think what I really heard with Monroe was there's a lot of work that's being done with the schools, but also it's really working with the kids after they leave the building, right? Like, how do we support these young people when they leave the building? Because we know that the things happen and crises happen when they leave the building, and making sure that they're getting the right supports with the right practitioners. Because I think that's part of it too, and really destigmatizing the mental health aspect of it with families and young people, and really helping people access the right supports.
Thank you so much. Onondaga.
So I'm happy to report out on Onondaga. I'm the district superintendent here at OCM BOCES. In our conversation, I think there were sort of two takeaways. You asked for one, but I'll do two quickly. The first was really just appreciate what we interpreted as sort of permission for us to think outside of the box locally, given to us by the four commissioners who really talked about the need to collaborate, and so we really appreciate that. Second piece was we had a pretty robust conversation at the end about us being able to locally have some conversations about how services are delivered, what a continuum of services might look like, how we can collaborate better to make sure that kids and families have as easy an access as they can to the full range of services that are needed.
Thank you. Thank you so much. Albany?
Hi, I'm Anita Murphy. I'm the district superintendent. I think two things. We talked a lot about the bureaucratic red tape that we have to do to get the agencies on a local level to work together. No one's fault. I think it's just regulatory things that we need fixed. Another big takeaway was, as we start to think about this, we really need to think about geographically where we put these things. I may have rural communities in a county that will never be able to access something that's sitting in the city. And so being very thoughtful about that. And then we also talked about the lack of staff, beds and programs for children or families who are in crisis. Sometimes there's no place to go. So thank you very much. We appreciate this opportunity.
Thank you. Westchester.
Hello, I'm Darcy. I'll speak for my facilitator in taking notes. A few areas came out strongly, one being the burden of paperwork and data for collaborating on grants or getting them what the agencies require, and the need for more flexibility, that there's a lot of great programs out there and people who want to work on them, but that they're sometimes prevented due to laws and regulations of the state and the silos and the lack of communication among agencies, local and state, to say, is this grant, which sounds like a great thing, really what this community needs? And more discussion needs to be had among the people who are making those decisions and have that data and are processing that paperwork.
Great.
Lisa, can I add a couple more things too as Harold? The other thing was looking at wanting to be more proactive in how we engage. One of the things that one of the commissioners had mentioned was we get so caught up in get caught up in the problems and get caught up in the that we forget that, we get caught up in the process that we forget what the mission is that we're trying to accomplish. And we need to have more of a yes, we can attitude in approaching a problem, not get caught up in what we can't do. The last thing is that there was a discussion about trying to create more connectedness. And this is something that was connected throughout the entire conversation. How do we work with connecting our students? Their voice is important. There are things that they've walked out of this from this process. Trying to look at them in a more positive light and not looking at learning loss, but looking at trying to provide enrichment for students as opposed to thinking that this is a negative. The students didn't lose. What they lost was learning opportunities, and we need to look at developing more opportunities for them to be able to use the things that they've gained through the pandemic.
Thank you. So we are at 11 o'clock right now. I know that some people have jumped off. There was a poll, and in Orange and Rockland, I do want to hear from you all. I just wanted to say that there is a poll that we wanted to do to assess your satisfaction with this and help us frame our next steps. So I think you can, Greg, can you walk through the poll or what people need to do?
Yes, I just opened the poll. Folks should see it in front of them. They should be able to respond to all 3 of the questions. There are only 3 questions, so please take a minute to do so. We have 1 minute and 30 seconds left for the poll, and then it will close.
Greg, as people are doing the poll, can somebody from Orange and Rockland report out as well?
Absolutely.
So I'm Sarah Chauncey. I'll report on our group meeting from Rockland. We have had an initiative in our county for several years now, the Partnership for Safe and Healthy Youth. So much of the work we've talked about, we've been invested in and committed to for quite a while, and we've learned a lot along the way. What was brought up is there is very little competition at all amongst these agencies now. They're working together. We need obviously access to funding, and the possibility of doing blended funding would be wonderful. And one surprise that came up is that through one of our initiatives, the Youth Police Initiative, we learned that students in one of our districts, Spring Valley, actually want more police presence. So that's a kind of positive for us to see that. But so the Partnership for Safe and Healthy Youth is really working in Rockland County.
Thank you. And Orange.
So I'll go ahead and speak. My name is Bill Heck, Chief Operating Officer at BOCES, and Christina, if you're still on and want to jump in, please join. We talked a lot about having the workforce. We've really started to do more in terms of school-based clinics within our area. We've seen certainly the mental health issues rise since coming back from the pandemic, but they still exist. A piece of that is having the ability to staff those clinics. We talked about the blended and braided access to funding. That's a big piece for us as well. We do a lot certainly with our county in terms of our interagency collaborative team. So the communication there and the support is there, but we just need certainly access to the resources. We talked a little bit about family opportunity centers. We talked about the telehealth piece, but certainly, access to those funds would be certainly beneficial. But really, the thing that needs to be addressed is the workforce and having people in those positions. Christine, I don't know if you're still on, if I missed anything.
Yeah, this was a really impressive conversation. It felt like there was already an infrastructure of collaboration happening in this county. And so, there were those practical logistical issues that Bill just spoke to. But the other piece that I found striking and important was the conversation about teaching children to recognize when they're experiencing trauma that they have, and helping them understand where they need to go to obtain services. and also helping teachers know what they're seeing, that it could be a symptom and not just a bad behavior, and helping them essentially be the first responder because they are with children for such long stretches. So talking about opportunities to bring the systems together to do that kind of work and really support kids where they are, that was quite powerful. And it sounded like people were thinking about it in a practical way. Like it doesn't, this is not a whole new infrastructure. It's a few things we could do to build on the state's existing social emotional learning curriculum. So I really enjoyed this.
Yeah, and thank you for the opportunity to do this. I would certainly do this again.
So I appreciate everyone staying on. We're over 5 minutes, but as the commissioner said earlier, this is a first meeting. It's not a one and done. Really appreciate the conversation. We will share the notes, and you will hear from this group again for our next steps. We heard about the need to scale and amplify the great work that's happening to just continue to improve outcomes for our children and families across the state. This has been a great gift. I thank you all, and I wish you all a good weekend. Take care now. Bye-bye.
Thanks, Lisa.
Bye-bye.
Thanks, everybody.
Thanks, Lisa.
Thank you, everyone.
Thank you.
Bye-bye.
Nice job, all.
All right, folks, we're going to close the room in just a couple of minutes. So if you're all set, you can go ahead and sign out. Otherwise, you will be kind of kicked out of the room when we close the session. Again, we'll do that in just 1 minute.